Hi everyone, my name is Marianne Tripotto, and I will be discussing the nursing staff shortage that is an issue in healthcare today. I recently interviewed a nurse who is an assistant nurse manager on a medical surgical floor who recently brought to my attention how big of an issue the nursing staff shortage is. And I want to further get into detail on how this is an issue for them. So let's get into that. So first thing is it's difficult to coordinate and plan schedules and how the nurses are going to take care of the patients when they are down staff. So this is difficult for management to coordinate and plan. And then it also increases stress, not only for management, but also for the nurses who are currently on staff. They are going to be an increase in stress because they're going to be taking care of more patients than they should be because they are compensating for the shortage of nurses. Along with that is also a safety. So you're going to have an increase in a safety risk for your patients and also for your nurses, your current nurses who are on staff. With that, you're going to have an increase in safety risk for patients because your current nursing staff is going to be fatigued or burned out. So that's going to cause some mistakes or errors on their end that is going to translate to your patients, which will increase their safety risk. And then also for your nurses, I feel that they are at a safety risk as well because they're taking on more than they can handle. So that stress level, their own, that's not good for them, for their work environment as well. And then within the past couple of years, this has become more of an issue because of COVID-19 recently. Within the past 2 years, we have seen a significant increase in nursing staff shortages across all healthcare organizations. And we're going to get further into how this affects the healthcare organizations. We're going to compare this with the iron triangle model and how this correlates with that. The iron triangle model brings cost, quality, and access and how they relate to one another. The idea of this model is to have two of them improve and one moves negatively. And we're going to see how this model works with a nursing staff shortage and how it can be an exception to this model. And we're going to break down each aspect of the model. First, we'll talk about how each of them would be affected. So cost, starting with that, your cost is going to increase with a nursing staff shortage. And we're going to get into detail with each of these. And then your quality is going to decrease with a nursing staff shortage. And then your access to healthcare is going to decrease because you're not going to have the staff to take care of your patients. And then within that, you can see that all of these are moving in a negative direction. Not one of them is moving or improving. So in this case, I feel this is an exception to the model. Now, if the hospital or organization were working to decrease costs by maybe making staffing shortage or making staffing cuts, that would be a different story. But right now, we're at a phase where we don't have the staff to even bring in to fill these gaps. So it's not that the organization is making cuts, it's that we cannot get the nurses in that we need. So in this aspect, they're all moving in a negative direction. And now we're going to break down each one individually and kind of get into detail on how they're negatively impacted. So cost, we'll start here. With a nursing staff shortage, you are going to have an increase in cost for the facility. This starting with recruiting. Now, you're going to be trying to fill in these positions. So with recruiting, you're going to maybe be on websites to increase, like Indeed or some kind of site like that. So you're going to have a cost with that, along with maybe you're in different colleges recruiting graduates to come in to fill these gaps. Also, with recruiting, you may be recruiting through like a travel nursing site. So this is actually a great way to fill those positions for a short period of time, but you are going to have an increase in cost because you're going to be paying higher wages for those travel nurses, and maybe paying for their travel expenses and things like that. Also, increase in wages. So you're also going to be attracting your new hires in with a competitive wage because you are competing with other organizations who are fighting a nursing staff shortage as well. And you're also going to have to increase in wages for your current nurses who are on staff. You're going to want to keep them happy and keep them because they are compensating for the shortage that you have. So they are taking on more responsibility. So you are going to have to increase those wages as well. And then patient safety. This is going to be an increase of risk or increase in cost for the facility. You may have an increase in falls, you may have an increase in mistakes or errors because your nurses are fatigued or burned out, things like that. So your patients are going to be an increase in safety risk, so that means that you're going to have an increase in cost for the organization. And then lastly is outsourcing. You are not going to have the staff that you need with a nursing staff shortage. So as we're experiencing now, we're outsourcing patients to other facilities to say get tests done or procedures because we don't have the nursing staff that is needed to perform those for our patients. So we are losing money in that aspect, which is not good for the organization. A good thing. And then quality. Your quality is going to decrease significantly with a nursing staff shortage. You're not going to have enough nurses, which means you're going to have a high nurse to patient ratio. This will cause an increase in safety risks for your patients, so they may be at higher risk for falls, they may be at higher risk for mistakes or errors because your nursing staff currently it has increase in stress. They may be fatigued or burned out, which certainly can cause an increase in safety risk for your patients. So yes, and then we're going to go to lastly, access. So with access, your access to healthcare is going to decrease with a nursing staff shortage. You're going to have a high need for healthcare, as we already see today with COVID-19. We had a surge in healthcare needs, but also we're going to have an increase in needs with the baby boomers reaching of age where they're going to have more healthcare concerns and need to come in to get healthcare. And we're not going to have enough nurses in order to do so. So that is an issue, and we're not going to have a decrease in access. So that's not good, and we're going to have to outsource our patients. Our patients are going to have to go to another organization, like I said, to get tests or procedures because we don't have the nursing staff to help with those. And then in conclusion, to kind of wrap all three of those into one, is that I feel that the nursing staff shortage is an exception to the Iron Triangle model, as they are all moving negatively. Cost is increasing, quality is decreasing, and access is decreasing. They're all moving negatively. This nursing shortage, as you can see, kind of hits every angle, and it's really a problematic for everyone within the organization, not only management, for your patients and the whole organization as one. And then lastly, here are the references that I used for this presentation. Feel free to further look into this. There is a website here that goes into further detail on the impact of nursing shortages and how it's affecting management and the organization as a whole. And yes, so hopefully we will find ways to battle this nursing staffing shortage and find ways to make this not a problem in the future. Thank you for your time.